Hello, my name is Haley Barron, and today I will be identifying 5 external structures that can be located on the outside portion of the body. Beginning with the first structure, it'll belong to the skeletal system. Actually, the first structures will belong to the skeletal system and will be located within the thoracic region. The first one will be the sternal notch, and then just below that will be the manubrium of the sternum. Located beneath the manubrium of the sternum would be the body of the sternum. Now, located in between the manubrium and the body of the sternum is going to be the sternal angle. This is used as a landmark for counting ribs because it is at the level of costal cartilage of the second rib. And also, the body of the sternum is considered the midline bony structure within the thorax. Located inferiorly to the body of the sternum would be the xiphoid process. Again, the sternal notch, manubrium, body of the sternum, and the xiphoid process, all located within the thoracic region and belong to the skeletal system. The fifth structure I will show you is on the anterior portion of the forearm, would be the cubital fossa. The cubital fossa is going to belong to the muscular and the circulatory system because it is outlined by different muscles and also contains within it the median nerve, brachial nerve, tendon of the bicep brachii, and the radial nerve. The reason why it's important to know surface anatomy is because clinicians are going to use this as a way to aid in diagnosing medical conditions and also for treating their patients. Also being able to relate the external structures to more of the internal, deeper structures within the body. A clinical application for 2 of the structures I just showed would be the body of the sternum. Knowing the location of the sternum and its anatomical landmarks makes it easier for and aids and is more helpful when you're trying to hear the heart sounds. So you would know that this portion on the right side of the sternum is the aortic valve, left side is the pulmonary valve. Just inferior to that would be your right AV valve and then your left AV valve. The next one we would clinically apply is the cubital fossa, and because located within the cubital fossa is our medial cubital vein. This is the most common vein that we are going to use to withdraw venous blood for testing. It's because it's easily accessed, not many nerves surrounding it, and also because it's the most closest to the surface. So again, my 5 external structures that I showed are the sternal notch, manubrium, body of the sternum, the xiphoid process, all belonging to the skeletal system within the thoracic region. And interior of the forearm is going to be the cubital fossa belonging to the circulatory system and to the muscular system. Thank you.